Let's find out how my medical assistant is hired and how she is so productive in my office. Hello, my name is John Lynn. I'm a urologist here in Gilbert, Arizona. Also, your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everyone's benefit. In this live stream, Danielle Freedman, a practice administrator from Las Vegas, will be asking questions of one of my medical assistants, Nikki, who is sitting in the same room here with me, and about her journey so far here at Sunrise Urology. So Nikki's sitting over there. We're trying to do this physical distancing, and then Danielle is in Las Vegas. So welcome to the studio, Nikki, and thank you for being here, Danielle. Now, first of all, before we go too far, I like to do like a quick background of our practices. Now, Danielle, you're in a solo provider practice. I'm a solo provider here at Sunrise Urology. So just for some context, but I think whatever we learn here is applicable to a lot of practices across country, large or small. But thank you for your accepting my invitation to host this interview live. So fire away with any questions that you may have for Nikki. I know you're interested in how she was hired and all that good stuff.
So like one of the biggest things that the biggest problems that I face as being solo practice is actually not really having a whole lot of HR training, and we don't have an HR department that does all this hiring and for us. So I always like to talk to people that are in solo practices, or actually any practice for that matter, of what their hiring process is like and how they know that the person sitting in front of them is the correct employee. So I wanted to know, like, can you walk me through how you were hired, like the steps that you had to take? Like, for example, I know Irma gave him a math test. I already talked to Irma years ago, and I stole that math test and I use it, and it's quite comical to see, some of the basic stuff that people are incapable of doing. What was your process like? I'm sure the math is only one of it, but what was your process like? What did you have to do? What steps did you have to take?
So I had a unique situation. I came here to Sunrise Urology as an extern right out of school. So I was able to basically kind of do a pseudo interview for 5 weeks. When I was finished with my externship, there was not a position available for me. So I had gone to another practice and worked there for about 5 months. And then I reached out to Irma and said, hey, if you guys need somebody to come in, let me know. I'd be more than happy to interview for the position. When she did call me back in and say that she did have something, I was definitely at that point ready to move on and come back here. And I didn't have to do the math test because I had had the experience with the team, and I had worked with the team one-on-one for that 5 months. So they knew who I was, I knew who they were. And they had asked a lot of questions during that time. What's your history? What's your past? What kind of things do you want to see yourself doing in the future? What do you like to do in your off time? That's all very important to get to know the person, just so that you can understand who they are and what they're going to bring to your team.
So she's she didn't go through the typical hiring process because she was she did an externship here for several weeks. And we were sad to leave her to have her leave, but we didn't have a position open. And when one of our MAs left or was uninvited, shall we say, from the practice because she couldn't recover from, we had a staff outing and I took everybody out and their families, and she could not recover from that Friday outing on Monday, and she had to call in. So that was when there was more to that, but that was when we decided that we needed to hire someone new. And we were very fortunate that Nikki was available. Now, normally the hiring process goes like, we ask for candidates, and as you know, a lot of candidates won't show up, even for the initial appointment, let alone passing the written test and the simple anatomy, verbal comprehension test. So we do that testing, and then if they pass that round, then they're interviewed at that time, and then if they pass that round, then we do a background check on them, and we also have them kind of shadow the MAs before we hire them. So my philosophy and Irma's philosophy is that we hire quickly, but we fire even faster. Meaning, when I know somebody's not going to be a good fit, we will let them go ASAP. As you know, when someone is not pulling her weight and is a Debbie Downer, it drags the whole team down. So we will excise that cancer ASAP and have no problems doing so. Even though when I was running the practice by myself, I hated firing people because it's unpleasant. But thankfully, I have Irma to help with that now.
It's not pleasant to fire people.
No,
I've had to do that.
It's not. Yeah. And yeah, we'll get to Nikki's background in just a second. And Joe is watching, who says hate when that happens. And I want to encourage all the viewers to please post any questions you may have regarding practice management, coding, billing, or if you have questions for Danielle, if you have questions for me or Nikki, please leave them in the comments below. So a little bit more about Nikki. She's kind of extraordinary. She's not the typical MA, goes through MA school and then comes to work in a medical office. She was actually a manager at a Home Depot. So she had managerial experience, and then she decided, hey, you know what? I want to do medical assisting. Went through school, went to a practice somewhere else, and then came back to work here. So we were very fortunate to have her back here. So that's her background.
Do you typically hire externs when you have like openings usually, or is that usually how you find most people? Or just you got very lucky at that point?
Yeah, we were very lucky. We took a chance on her, and she took a chance on us, and it just worked out.
So what questions specifically, like, did you ask her, and how did her answers stand out to you?
I do not do any of the hiring or firing anymore. Irma will consult with me, and then that's pretty much it.
I did talk to Irma a little bit prior to this conference, and I asked her what kind of questions she would normally ask. And starting with, why are you looking to work in our practice? What kind of things did you like or not like about the practice that you were previous in, or the job that you were previous in? And she had mentioned that if somebody says, I didn't like my boss, it's done right there. Just because if they can't get along, not always.
Yeah, the boss could be a jerk.
Yeah, but then she might ask a couple more questions about that and then dig some more. But a lot of times you get a good feeling just asking them about themselves. And when I was doing a lot of interviews, I did a lot of interviews when I was working at Home Depot. I was there for 14 years, so in that time frame, I was a manager for 5.5. But in an interview, you get more out of asking them questions that they don't think you're going to ask, like, what do you like to do in your off time? Or what's your favorite color and why? Or what's your spirit animal? That's a random question that you can get a lot of information for, because you want them to tell you why is a monkey my spirit animal? The monkey is my spirit animal because I feel like I've got a lot of energy and I can bounce around from thing to thing and still multitask and get things done. So that's and then that created an answer that it was equivalent to kind of a question. Does that make sense?
It does, yeah. My spirit animal is a dog you can't see.
Well, I have 2 dogs at home, so I totally understand where you're coming from.
Yeah, I've got 2 of those too.
So how do you, now that strictly in your urology office, how do you prioritize your to-do items, for the day? So like when you walk into the office, what's like the first thing you do? I mean, besides turn on the computer and the basic stuff like that, and check the SIDEX and that kind of stuff. What's the first thing you do? How do you prioritize what needs to happen, and how do you organize it? Because everyone organizes their day differently, and it always amazes me how different people do things, and I'm always learning new ways to kind of to figure out how to better my day, if that makes sense. How do you do it?
So the day before, so yesterday, well, actually Monday, I already knew that coming in today, I was going to start off with a cystoscopy and then have 2 more cystoscopies and then have a vasectomy. So planning those procedures is very important, because if you have those procedures in your head, knowing what's going on, you're not having to do a whole lot of prep for those procedures because you're already prepped for them. That way you can handle all of the other patients that are coming in. Thankfully,
you lay out the tray for the vasectomy in advance?
It's already laid out. So we've got our trays pre-packaged. Okay. So we autoclave them already pre-packaged with everything in them. We bag the suture, the steri strip, the needle, and the and everything we need that's not needing to go into the autoclave in a little bag. So we've already got all those prepped, and then we just dump the bag and go. It takes me about 2.5 to 3 minutes to actually set up a vasectomy. So, which is a lot faster than me having to go dig around for all of the parts and pieces. But knowing what procedures I've got coming up is very helpful, because then I can have all of that stuff prepped and ready to go. And when we have new patients or existing patients coming in, we already know who needs what, and if we're missing imaging or labs, then we've already contacted those patients and taken care of that. So everything else goes very smoothly. If those new patients have doctor's notes that have been sent, so consults that have been sent to us, then we pull as much information out of those consults as we can, so that we're not having to do a whole lot extra prep, especially for some of those patients that have a lot of medications or a lot of history, because that is very time consuming when you're doing that new patient information.
So do you put in the medications in advance?
We try to, if we can. If we can, we try to do that, just so that we're already ready to go. And then we also, of course, we review them with the patient on the new patient paperwork, or even just asking the patient prior.
So I think what she's saying is that there's a lot of preparation and anticipation of what's about to happen the following day, and Linda and Nikki will do the advanced planning the day, or maybe sometimes 2 days before, depending on what it is. Is that chasing labs? Is it chasing imaging and stuff like that? So I think a lot of practices that are super, super busy, they don't allocate time for the medical assistants to do so, to do the catch up. So
what do you do at the end of the day, at the beginning of the day? Where do you get that done? Like when the phone's ringing off the hook, and how do you prioritize that in the day?
Well, hang on a second now. The phone's ringing off the hook. That doesn't, well, I don't know. Nikki, you answer. Does that happen here?
No, it doesn't happen here. We are very quick to answer the phone. Everybody in the office is. If it rings more than twice, then we know that something's going on. So as a medical assistant, I'll pick it up if it rings a second time.
But why doesn't it? Why do you think it doesn't ring constantly here?
Because you get the stuff done first, like on the first try. You don't have to keep calling back.
You got it. Yeah, that's definitely. And anticipating the question, because the patients ask the same questions over and over. And if you can write that down, either verbally tell them or present a piece of paper so they can review, you've already answered the questions ahead of time. You're being empathetic to them by answering those questions ahead of time, verbally or with a handout. So they don't call you. We rarely get those calls that are, in my opinion, not necessary when you can plan and anticipate.
Well, do they read? I mean, do they actually read the stuff you give them?
Sometimes they do, sometimes they don't. But that's why I say verbal. Some people do better verbally, right? And some people do better with reading. And if they are the kind of person, if I sense that's kind of person who doesn't want to read, then I will do the verbal reminder. Okay, here are the things that you need to do.
But what do you do, which is a common scenario in my office? The patient tells me they're coming in for kidney stones, so I track down all the imaging and stuff like that. But then they get in the room and they say, I have, some other completely irrelevant, condition that I did not know to get records for. Do you make them come back for a separate consult while you chase that stuff down, or do you have them wait in the office while you go get it, while your MAs go get it? For us, I've been just sending them out and saying, well, you have to come back and review it when I can have time to get it, because it just holds everything up when they don't give you the full information up front. You know what I'm saying?
Despite our best efforts, sometimes that does happen, right? Sometimes the patients will simply, they're not comfortable telling us what it is that they're coming in to be seen for. And that's a very, thankfully not a very common scenario here in the office, but it does happen. And it surprises me too, because sometimes they'll say, okay, well, I'm here for blood and urine, when they're here actually wanting to talk about ED. But thankfully, I think my staff is very, very good in getting that initial reason for visit when they make the appointment, and also when they actually show up here. Sometimes they'll reveal something of why they are really here, that they were not comfortable talking to someone over the phone. So thankfully that doesn't happen too often. But the way you manage it by sending them away while you gather information, I think is probably the best way to go, because if the patient's not giving you forthright information and you don't have all the data to adequately treat the patient, unfortunately it's an empty appointment slot for you. But I think the best thing to do is exactly what you did, is to send them back and then gather information and have them make another appointment.
Well, sometimes too, and I've stopped a lot of this by getting rid of the insurance carriers, but sometimes too, like it won't be a covered benefit what they're actually coming in for. Like erectile dysfunction is not always covered by the insurance companies. Hematuria is, but erectile dysfunction is not. And if I can catch it before they show up, then of course I save them a lot of money, but it's nothing worse than having an encounter come back with ED on it when that's completely exclusionary, and then the insurance company denies your claim, for that, and the patient gets stuck with the bill, knowing that what they were doing in advance. You know what I mean? So that's
right.
kind of another issue.
Yeah, they're trying to game the system, right? They say that they're here for something else, but then when in fact that they're here for infertility or erectile dysfunction, that is generally not a covered service. Or on the other hand, if your provider is smart, he can document BPH without obstruction or BPH with obstruction and has ED. And you can treat the ED incidental to the other problem, making the other diagnosis primary. But that goes to understanding coding and billing and knowing how to play the game.
Right, exactly. Makes sense. So can you give me an example of like the steps you take to handle a difficult patient? Because we all have them, and I've got plenty of my stories of difficult patients. But how do you do you have a protocol in place for each incident, or do you just take it?
So what do you mean? Difficult patient?
Well, not someone necessarily abusive, that you just kick out of the office. That's easy. But someone that's difficult, like calling multiple times for the same issue without really listening to you. The annoying ones. Put it that way. An annoying patient. How's that for terminology?
How do you handle that, Nikki?
I send it to Dr. Lynn. No, I'm just kidding.
No, I mean
I send a message to Dr. Lynn.
Yeah, that's a reasonable thing, and this is sometimes what happens. It could happen to Irma, it could happen to Nikki or Linda or anybody in the office. They will document in the patient messages, the official documentation record that is kept in the patient's chart. So they'll document the call clinically, but then in a private message, they will send me, it will detail what exactly is going on so that I can address the concern in the EHR appropriately. Meaning the patient can go somewhere else, or I'll come up with a solution that is amenable to the patient's needs. But we rarely have those. Thankfully, we rarely have those issues.
Mm-hmm. That's very true.
Right, but it happens. It's not perfect.
Yeah.
So.
Oh yeah.
No.
Anytime you deal with people, you're gonna get some. You're gonna get some kooks.
Oh yes.
Right. Exactly.
I mean, Nikki's worked in retail for years, so she knows as well.
Oh, I have no doubt. So, Nikki, what made you choose to work for Dr. Lynn? What were your reasons for choosing him after you had finished your 5-month job someplace else and came back to him? There's got to be something that made you want to come back.
I really got along with everybody here. I do. I get along with everybody here. It's a very positive environment. Dr. Lynn and Irma both do everything they can to make sure that we are taken care of. Right now, we're working limited hours, just not for no other reason than everything that's going on. And they don't make it difficult for us. Our families are still doing just fine. We have a great relationship, and it's a very open the open communication is there. Nobody talks down to anybody. There's a positive atmosphere and a positive energy in the office pretty much every day, all the time.
And the medical, what was that?
Anything I don't like?
Yeah. There's got to be something or something you don't agree with.
No, I'm just kidding. I was thinking about that throughout the day. To be honest, there is not anything that I don't like. I mean, of course there are going to be things that I question, but I'm, again, not a doctor, so I can't question his decisions.
Right. As
far as the office is run, it is run very, very well. It's a very oiled machine. Irma has a lot of good practices in place, and she is open to any new ideas and anything anybody has to say, and she's willing to try and implement ideas and see if they work, and if they don't, we'll go back to the way things were. But this practice is very accommodating to somebody who has been in a lot of different positions, And like I said, it is a people, it has a lot to do with the people. And that really is it. Because I loved working in cardiology. I loved the cardiology. I loved EKGs. I loved learning about the different medications. I loved doing all of the procedures that I did with them over there. But the people is what brought me back.
I think if you look at a lot of different businesses, they'll often say that the culture is what makes someone want to continue working there. And I think we have our core staff that has built a very warm, welcoming culture here in the practice, and that is very attractive for a lot of people. And we try to retain the good staff. And despite what some people may, how some people may think, the patients or the customers are not really your number one priority. For me, my staff is my number one priority because there are plenty of patients, but it's very, very difficult to find good staff who meshes well with the entire team.
Something that was drilled into my head in that long period of time at that retail establishment is Bernie Marcus said, as long as you take care of your people, your people would take care of the customers and everything else falls in place. And I truly believe that is how it works, because people don't quit jobs. They quit the people that they work for.
That's so well said.
It does make sense. So what's the biggest mistake you've made so far in urology? I know you've got something.
Me?
I'll make them. Yeah. Mm-hmm.
I don't know.
What are some of the things I guess you kind of wish you had known in advance, basically, and because you didn't know those in advance, you made some mistakes?
Thankfully, I have Linda listening to me when I'm having conversations with patients, and she'll say stop if I start to speak and say something I shouldn't say or say something incorrect. So I've been halted a few times, but I also sit and we're very far apart in our little area, but we are where we can hear each other speak. So I listen to her talk to patients all the time, and she listens to me. So we give feedback to each other. The biggest mistakes that I've made are not having the room set up completely and having to jump around and move around and grab things. I believe that I haven't told anybody anything outside of my scope of practice. So I'm very, very aware of what I say and how I say it to make sure that I'm covering my assets, and Dr. Lynn's assets, because it's very important to me that the practice stays profitable.
And that's it's so hard to find someone like that, right? Who's circumspect, who sees the big picture instead of, oh, I'm just going to do one thing. This is my little area, and I'm not aware of what else is going on. And also, when she does make tiny little mistakes, number one, I forget them. So if you want to ask me what mistakes she made, I can't remember them. Well, I guess once in a while she'll forget to bring the T-shirt, the post-vasectomy T-shirts that we give away. Okay, who cares, right? Us guys don't care about the little things that don't really matter too much. Well, I leave that memory to women so that they can recall to me when they're mad at me. So I don't care about the little things that don't matter. But you know what is really nice, or not nice, but I recognize that Nikki is very, very conscientious. When she makes a little goof, she'll be kind of hard on herself. And whereas I don't really care, as long as it doesn't harm the patient, I don't really care about the little mistakes here and there. But she's very conscientious. When she makes a little mistake, she's very apologetic. And I'm like, it's cool. It's okay. Doesn't matter.
There may be words that come out of my mouth.
That's true. But that's okay. I mean, it shows that she cares, right? It shows that she cares about the performance and the job that she's doing.
Oh, absolutely.
And let me pause here real quick. If anyone who's watching, if you guys have any questions or comments about how I run my practice, any questions for Nikki or Danielle, please type it in the comments. Joe's been very prolific. He said when it comes to vasectomies, he said, love it. Our MAs set vasectomy kits ahead of the time as well. And Joe also says he checks his email if he hadn't done it already 2 or 3 times overnight. I used to check my email all the time, but nowadays I rarely check my email. Maybe once a day if I'm lucky. So I miss a lot of emails. But if you DM me on Facebook or text message me or on Insta, Snapchat.
If you want me to ignore you, send me. If you really want to get a hold of me, text me or send me a DM. don't come to my office. I will ignore you, especially if you come to my office. Like it's like sales reps. Oh no. You really want me to ignore you? You just come to my office in the middle of the day with no warning. I'll take the coffee from you, but you're not getting back here.
Yeah, well, we do have our favorites who are very respectful of our time and privacy, and some are just really, really nice people. I've known them professionally and then now personally to help them advance their careers. So those people we don't mind seeing at all.
I don't know. I kind of have mixed feelings about that because a lot of them, I like the people. They're very nice. Don't get me wrong, but it's just like I don't have time to show you pictures of all my children and like all that stuff. Which they want to see. They come in and they're part of the family because they've been to my kids' birthday parties and my wedding and all that stuff over the years they've been to, and I don't have time to like talk about it right now. I've got all these rooms to fill.
Yeah, but that's why they're Facebook friends. But you know what? If they are truly your friends, they would understand. Like Rachel came in recently with her boss, and usually they know me better enough to just show up with their managers, right, or the district managers. I generally will set aside a little bit of time if they give me some warning that they're going to be here with their DMs. I will put them in a light that is positive for the reps. When I know that there's going to be someone shadowing them. But if they give me no notice, like Rachel did recently, one of the reps, just like you, I had to blow her off because there were patients to be seen, and I would just go. Obviously, the patients come first before any reps.
Right. That's kind of how I feel about it. So I kind of, unfortunately, I don't mean to be rude, but no, you're not getting back here. But thanks for the coffee.
Yeah, but the reps understand that. They're fully aware.
Yeah. Yep. All right. So last question: if you were the manager, Nikki, what would be the one thing you would do differently?
Again, I don't have. Irma does a phenomenal job in this office, managing this office. And I don't have enough background in the medical field in order to be able to adjust anything as a whole. I think that because I am very focused on the MA area, I do eventually want to learn billing and coding and all of that process. But as far as the MA area, it is, like I said before, we are given the freedom to make changes and adjustments that we see fit. And I think that as a manager, I probably would not run this office any differently than Irma does. She's very attentive to our needs. Again, like I said before, she is understanding. She's always available. I walk into her office and I ask, I feel bad sometimes because I know she's working and she's got a lot on her plate, but I'll ask her a question. She's like, no, it's always a no, I've got plenty of time. That's how I ran my business when I was a store manager. I always had time for everybody. And that is one of the things that I love about Irma and that I respect about her and everybody here, because everybody has that, okay, you got a second? That second, you can sometimes turn into a minute or 5, but everybody's got a minute. And that's very helpful. And in me even still learning, I've only been a medical assistant for a year now.
Oh, wow.
So even with me still learning, because doctors practice, everybody practices in the medical field, even in the retail business, you practice. But I'm practicing, I'm learning a lot. Every day I learn something new, and that's always my goal. If I haven't learned something yet that day, then I go find something to learn. So, but Irma, like I said, I don't think I would change anything and it's hard to say that too, unless you're in that position and you see actually what she's doing. Mm-hmm. As opposed to being part of the team and involved in everything. So
I'll just make a couple of comments. Number one, having an open door policy and being accepting of suggestions from anybody and everybody. I think that is really important. An open door policy, basically. A lot of the positive changes have come. I'll just give you an example. I was thinking about how to get my vasectomy instrument tray closer to me because that extra 6 inches was inefficient. And I was trying to figure out how to position the tray. Do I need to get a new tray with the legs that can fit under the vasectomy table?
Mayo stand?
The Mayo stand, exactly. We were trying to figure out how to get I was trying to figure out how to get the Mayo stand closer to me at the foot of the bed by about 6 inches because that extra reach was inefficient. You know me.
Yeah.
Nikki was the one who came up with our current solution without having to spend extra money to buy new mail stands. She simply said, you know what, I was experimenting, and she lifted the bottom of the stand and put it over one of the legs at the foot of the table, and that solved the problem. So now I literally reach over like this far to get the instruments and then bring it back. And it's such a huge effort and time saver for me. But you know what? It came from her ingenuity and coming up with solutions. So having an open door policy and always being amenable to ideas from your staff is absolutely important. And also the AUA symptom score that we use right now, it's laminated. It's not a piece of paper. You don't have to shred. There's no HIPAA issues that you have to worry about.
You walk out of the room if it's not done. I remember that. That was funny. I saw that.
But it's an erasable. But the key is it's an erasable board. But that idea came from a former medical assistant who said, "Well, why don't you just laminate this thing so you can erase it and be done with it?" Because I record the numbers on my HPI template for urinary difficulties, and I don't need it anymore. I don't need to scan it. That's extra work, and that's extra paper. It's bad for the environment. It's not green. So that idea came from a medical assistant. And learning never stops. You want to keep an open door and an open mind.
Makes sense.
Emily, well, you know Emily. I'll see any and all reps that bring crumble cookies, though. We know about crumble cookies, I guess.
That's true.
Well, tell me how things are going on your end, Danielle, in Vegas with the COVID-19 public health emergency.
We have not had it nearly as bad as like New York, for example. Like our population isn't that high, so we have, of course we have COVID-19 here, but not to the extent that other places are being hit. Our biggest, obstacle right now is the economy, because we're a tourist, city. The entire strip is shut down, as well as all of our restaurants and everything on that strip, and that employs the majority of the people in this, in this community. So from how it filters down to our business, a lot of them are being furloughed, and they're only extending the benefits, the health insurance, for a few more weeks. So we're kind of worried, because a lot of my contracts are mom and pop with the casinos. What's going to happen, because now they've postponed the opening of them until the end of May. So now we've got another 5 weeks of, and they might even keep, it might even keep going. We don't know. So we're kind of worried about how we're going to be bringing in, enough volume, for the next, month and a half or so. So that's something we're just going to have to wait and see. We've started doing telemedicine. I've also come up with a couple different cash, structures for telemedicine to kind of help those people out, to make it more affordable if they don't have, health insurance in the future. And we're slowly working on that. It's a little bit different dynamic, because my dad's the physician, but he's not nearly as self-sufficient as you are. Like, he's not tech savvy. So, my sister and I are both his scribe, and we also, we run around and room patients, and we answer phones, and we do all that stuff. We do his coding for him, and we have a biller. So it's a little bit different dynamic, because you can do all that stuff. We have to, do all that stuff for him. So when it's telemedicine, I've got to sit there with him while he has the consult and transcribe and put the notes in the system for him while he's reading it over my shoulder. So we're working out the inefficiencies of that right now.
So how has telemedicine implementation been going?
So far it's going okay. He's finally got the concept that there's actually a camera in front of him, so he has to, be presentable. He can't walk away like he does for other meetings, because people can see you. So once he got that concept figured out, I think we'll be okay. But for a while there, he thought he could walk around with the speaker on, with his earpiece and just talk to the patients, so they're talking to a chair, So. Yeah,
there's certainly etiquette issues and technology issues. I've told you this before. He is very, very lucky and fortunate to have you and Emily there. Otherwise, I do not think he will be as successful as he is.
Well, thank you. That's very true. I mean, and he's also always late, so he would drive you nuts.
Joe mentioned in the comments, fun fact, he is also his dad's office manager. So that's interesting. And Karen Brown says, I agree with open door policy, very important relative to getting good ideas. And Joe says, my door is always closed to Karen. They work in the same office. Yeah. Emily says, thanks, I appreciate that.
Yeah. No, I learned a lot. Thank you very much, Nikki. I appreciate you taking the time to talk to me today. I always like to learn from from MAs, because I never had any MA training. I was just like, oh, we need you to come back home, start doing this. And I'm like, okay.
Yeah. And you had asked me, and I didn't answer the question specifically. Part of one of the questions was, what did I wish that I had knew more about urology prior to coming to the practice? And to be honest, MA school is 9 months. So you get kind of a gist of everything in that 9 months. So it's an on-the-job training every day. And even when I was working at the cardiology office, it was on-the-job training every day. I knew a little bit, and I'm older. I'm older. So the retention is a little bit slower, and it takes me a little bit longer. Instead of the 2 times, it may take me 3 now. So, but the retention from school being so quick, I didn't retain a lot of the common medical terms. So Google is my best friend still. To be honest with you, I use Google a lot and I don't trust like the Wikipedias or anything. I go to the Urology Association website frequently and look up answers, or I'll go to Mayo's website, and those are my 2 trusted websites that I'll go seek out answers for me to help me learn, so that I can take care of the patients better.
So one of the characteristics that you want, right? Obviously, someone who's constantly willing to learn and looking to do better, and that is, I don't know about your experience in hiring people, but that's hard to find, right? Someone who is
possible to find sometimes.
Yeah, someone who's willing to learn, who is not complacent, and that is the hardest thing. No matter who it is, whether that's a medical assistant, office manager, or urologist, complacency is the worst thing when it comes to progress and advancements and bettering yourselves. A lot of people are like, okay, well, I'm doing good enough and that's all I'm going to do, which is fine. That's great. There are people like that. But I've known you, so you and I are not the same. And neither is Nikki. I think like begets like. And I think people who have the same work philosophies tend to want to work around people who are like-minded. So we're fortunate to have Nikki, who's like
yes,
that.
you are, absolutely.
So how are you finding your new hires nowadays?
Well, I'm not going to lie to you. I have not been I'm not known for being the best person to hire somebody. I have a hard time, with it, because we tried Craigslist for a while, and Vegas is a little bit different dynamic because just the culture. It's a very transient population. Most people, I happen to be born and raised in Las Vegas. This is my home, but 99% of the people here are not born and raised here. They moved from someplace else. So it's hard to find people that come here to stay, so that's my biggest complaint about the workforce here, because people will, and also it's also a trap town, because people can get a job working on the Strip making, $70,000, $80,000 a year valet parking cars versus,
wow.
It's a trap town because you can make a lot of money doing very low skill work. I'm just being honest. And MA is a very stressful, high level proficiency job. So it's hard to find people that really want to come and work in healthcare.
Why be an MA when you can be a pole dancer?
That's exactly what I hear. I'm not even going to lie, or you'll get somebody that, they don't have any clear direction. So you can just tell that we're a stepping stone to the next thing. And I don't really want to train somebody for, 6 months to a year to have them take off when they, get that trap job. And, you can scoop ice cream on the Strip and work swing shift and make 3 times sometimes what you'll make at other jobs that are, far more difficult. So it's a whole different different, dynamic. And I struggle with that. I struggle finding quality help. I've tried hiring agencies that try to find people for you, and they charge an arm and a leg to do that for you. And I found a couple of good people that way. But again, they left after a year. Because even when you offer them more money at that point, they don't want it. They want the easier job that's, going to pay more money, if that makes sense. So
yeah, certainly. Yeah, it's
the people I do have been here for years. I mean, we've had, someone there for 35 years, and I was a baby. She was literally when I was born. We've had someone there, a biller that's been with me for 11 years. My sister and I have been there for 11 years. So we've got a good group, but we've had a revolving door of MAs for a while. So.
Well, very good. We are running a little bit long. Joe says, wait, what? I'm going to be a valet. You're going to be a valet in Vegas, buddy. Anyway, I don't want to keep you guys any longer on this live stream interview here. So I want to thank Nikki and Danielle for coming on. Danielle, great questions, by the way. And thank you, Nikki, for being here and helping a lot of practices. And hopefully they have some takeaways to improve their processes.
I hope so.
Any parting words, Danielle?
Stay safe. Wear your masks, wash your hands. I mean, you've heard it a million times, don't send me an email about washing your hands. If I get another one of those, I'm going to scream,
Nikki, any parting words?
Just stay safe. Just like Danielle said, this is a unique time right now, and we will get through it. So
I'm going to say that you all should definitely start planning for what is about to come, the onslaught of post-COVID when it comes to taking care of patients. And also, how are you going to incorporate telemedicine even without the laxed regulations currently available by Medicare? Are you going to continue to offer telemedicine even if there is no Medicare payment, even if they restore the originating site requirements and things like that? And how are you going to implement that? Because there's no way I'm going to go back to just the way things were when telemedicine is available. And I think there's a lot of opportunity for cash telemedicine services, because time is money. And guess what? Time is something that you cannot buy with money. So do
you love telemedicine, by the way? I mean, do you love it?
I love it.
Yeah.
I love it. Just like in real life, and I can do it every 10 minutes and on the clock. And if I'm running early and the patient's already in the virtual waiting room, I will see him or her right away. It is super efficient. No one's ever complained. None of the patients have complained. And the oldest patient.
You pay for the extra money, $35 to get the text them the link to the room. Did you pay that on DoxyMe?
The text link? No.
Wait. Ask that again.
Oh, I just was curious about the DoxyMe. They have a service that's $35 a month on DoxyMe that you can actually text the patient the link to the room. So your MAs don't have to go over that stuff with them in advance. You can just text it to them, to their phone number, so they have it right there. I was just wondering because we've been using it and I love it. That's why I'm asking, because.
Yeah, if you let's see, I paid $348 for a year, which is dirt cheap, by the way, for the features that they offer in a HIPAA compliant fashion. I can continue using the same platform without having to change after post-COVID. So the $348 per year plan that I sign on to gives me the ability to send them an email or text them the link. And I actually, what I did recently was I received a phone call from a patient, one of those rare instances I get a phone call after hours. I didn't even call them back. I simply logged into doxy.me on my dashboard as a provider and texted the link for them to log on to doxy.me. So I had a telephone, synchronous audio and video conversation with this patient and his wife in a post after hour call, which is great. So yes, the feature is built in if you buy the most basic plan, which I believe is the clinical plan. Mm-hmm. So we bought we bought it.
Very cool.
All right. Stay well, be healthy. Thank you all so much for watching. And Marcy and Karen and Joe and Emily, thank you so much. Have a great evening and be well. Take care. Bye-bye.
Bye. Thank you.
Bye. Thank you.